At Manipal Hospital, it is always our endeavor to do world-class surgeries and surgeries which have an early recovery and which prevent knee damage and which can preserve our knees. Recently, I would like to talk about a patient which we operated. He's a young guy who had an injury in his knee and he was ignoring it. There was a meniscal tear. He knew about the diagnosis, but still he was delaying the surgery because of other reasons. He didn't want to undergo surgery, and he had few perceptions about surgery, that surgery is very complicated, difficult, and it will take a long recovery period. Due to which, again, he had an injury while dancing, and he injured his cartilage in the knee. For a young person, damaging the cartilage is very bad, because the cartilage damage for a young person can lead to bad arthritis at a very early age, and the patient would have to undergo a knee replacement at an early age. What we did was the first case of its kind in Gurugram. We used a special device which is FDA-approved, which is known as chondrofiller. It is a type 1 collagen which is to be inserted inside the joint over the cartilage, which helps in repairing the cartilage over a period of time, and the person gets pain-free mobility and the knee is preserved so that the person doesn't go to severe arthritis or a very bad knee which requires a joint replacement surgery. This was this young guy. We operated, we did everything through a keyhole surgery. So it was very advanced technology which we used. This is the first time it has been used in Gurugram area. I never knew about it earlier, and the patient also did not know about it earlier. We got into discussion with the patient. We found out this FDA approved thing, and we wanted to do it for our patient. And the patient is very happy. We repaired his meniscus through keyhole surgery. We did the chondrofiller through that, and he only had 2 stitches in his knee. The very next day, we made him walk. He was ambulatory. He just has a knee support, and now he is into dedicated physiotherapy regime at our hospital on a follow-up, and he is very happy. He was saying that he was very apprehensive about surgery, and now he is so happy he has undergone that, and he is recommending it, and we are also doing more cases like this at our hospital. Thank you.